Welcome, everybody. We'll just give a few seconds for people to join. Good morning, good afternoon, good evening. Welcome once again to today's WHO EPI-WIN webinar. Today's topic is on evidence for impact, advancing community-centered responses to mpox. Before starting the technical session, I would like to let you know that this session is being recorded. And we do have interpretation in French. So if you go to the bottom of the Zoom link, there's this globe at the bottom. You can pick which language you want to listen to. As usual, for those who are familiar with EPI-WIN, we love to hear from you. So please introduce yourself on the chat. Please share any insights that you may have on this field in the chat. But if you have questions for our panelists, please put it in the Q&A so that we can track it easier and make sure we don't miss it and we answer your questions. Once again, welcome. And with this, I'd like to hand over the session to Dr. Nina Gobat, Senior Technical Officer, who's led this work along with Catherine Litlin to develop this guidance. She's the technical expert here, and she will be leading the technical session. So over to you, Nina. The floor is yours.
Thanks very much, Supriya, and a very warm welcome from me. Good morning, good afternoon, good evening, wherever you are in the world, and thank you for making time to join us. This is an incredibly important topic for us here at WHO in putting communities really at the heart of the work that we do in responding to public health emergencies. In this webinar, we aim to do three things. The first is to introduce you to WHO's newly launched guidance in this topic. The second is to hear about the challenges. What has this guidance been developed to address? We'll be hearing from our panelists, but as Supriya has also said, we very much would like to hear from you. So please do let us know your questions and your comments in the chat. And third, we want to share with you some resources and very practical operational tools that we've developed to put this guidance into practice. And we'll share with you ways that you can stay connected with this community at the end of the webinar. But first, it gives me great pleasure to welcome our opening speakers, our Chief Scientist, Dr. Jeremy Farrar, and Dr. Nedret Emiroglu, who's the Director of the Health Emergencies Core Capabilities Department here in the Emergencies Program in WHO. Jeremy, the floor is yours to provide some opening remarks, and then over to Nedret. Thank you so much.
Thanks very much, Nina. And it is a great pleasure. Good morning, good afternoon, good evening, wherever you are, and to join this in partnership with the emergency program here at WHO. We live in very, very challenging times. I don't know about all of you on the call, wherever you are, but I almost have to bring myself to look at the news every day in some way, shape, or form. And we're living through a period of tremendous disruption. And of course, that is keenly felt in every country, but of course, in even more in vulnerable settings and those dealing with. So from everybody here, our thoughts with everybody around the world who's joining this call, and all your colleagues and friends and family members around the world dealing with a series of polycrises that are going on at the moment, and of course, the whole geopolitical situation we're in, which is affecting everybody. There's just two comments I'd like to make, if that's okay, before handing on to the rest of the session. The first is to share with you something that one of my great mentors and icons, actually, that I've always been fortunate enough to receive support and advice from, an individual called As C. Many of you may know him. I think he used to be the head of the International Red Cross and Red Crescent Society. I think he's now the chair of the Kofi Annan Foundation and the chancellor, I think, of the Liverpool School of Tropical Medicine. He said something to me which must be 10 years ago now, and I remember where I was when he said it. And in typical AS way, it was said with tremendous humility, but incredible meaning. And he said simply, everything starts and everything finishes with a community. And I think if we keep that at the heart of absolutely everything we do, in whatever we do, in public health, in clinical medicine, in dealing with the polycrises of today, within our families, our communities, our organizations, and in our own work, then I don't think we will go far wrong. And As you're not on the call, but I look forward to seeing you again. And thank you for those comments. I remember the place, I remember where I was, and I remember those words, and they've stuck with me ever since. The second is just to pick up on something Nina said, which I think is also critically important. WHO has some core mandates and functions, and of course, at the moment, we're looking at really trying to define those in a way that's for the current and the future. But those guidelines and normative functions WHO produces are, if in essence, a waste of time, unless they're grounded in communities, they're useful, they're used, there is a feedback loop so that they can get better, they're living so that they are dynamic and they can change, and they're actually contextualized and relevant to, yes, the world, but more importantly, context. And this feedback loop, including this webinar and the partnership here with the emergency program, is, I think, critical to that. So, AS, thank you very much. And secondly, grounding WHO's normative work in the reality of the world, I think, is the crucial lesson that we must take away. And I hope it's the heart of this webinar. So thank you very, very much for inviting me. It's a pleasure, as always. And I hand Nina back to you, I think, or onwards, upwards and onwards.
Jeremy, thanks so much for those words. Very, very impactful and much appreciated. Nedret, over to you.
Thanks, Nina, and thanks, Jeremy. Actually, this is what I was going to start with. That's our motto within WHO Health Emergencies program, that communities are at the center and everything starts at the community and ends at the community. So that's a big motto and a big message that we would like to bring the communities in all aspects of any emergency, either it's prevention, preparedness, or whether it's in response or recovery, or for any health threat. And actually, this is an indication of this sort of strategy being in action. WHO, as Jeremy mentioned, develops a number of norms, guidelines, and standards. But this is kind of specific because it is taking into account the full input and the reality in terms of the social, behavioral, different determinants within the communities that actually affects their way of accepting any emergency related threat or the way they could respond to it. So I'm really grateful that this could be a good example. And also this is a good collective work led by WHO Health Emergencies, and with working very closely with the teams for ethics and quality, but at the same time, engaging over 170 experts who were involving in the guidance development. These are a broad range of different individuals and experts with different experiences, from health, operational partners, researchers, ethic experts, civil society, and so on. So I'm really looking forward to hearing from you also as firsthand, and I'm sure that will be your intention to be able to continue with this sort of high quality, ethically appropriate, science evidence-based guidance and norms for WHO, but at the same time, listening to the communities, looking into their specific contexts and needs, and taking those into account. So I think this is an attempt to continue with this kind of specific targets in mind, and we will learn from each other to be able to also strengthen this work in the future. So thanks to you all, thanks to the panelists, and thanks for the good work to the teams, and back to you, Nina.
Thanks so much, Nedret. Very, very important comments there. And yes, this has been an incredibly strong collaborative process with, as you say, over 170 people who have contributed in different ways to this guidance development. And we will say a little bit more about that and who those people were. But I invite you very much, those of you on the webinar, to access the document, to have a look at the document, and indeed to give us your feedback in time as you start to work with it. But first, we'd like to hear from you. So I'm going to hand over to Supriya, who has a Slido question so we can better understand your experience of working with social and behavioral evidence in public health emergencies. Supriya, over to you.
Thanks, Nina. And as always, we'd love to hear from you. So please respond to this question at slido.com, #1594309. Please go to slido.com, #1594309, or scan the QR code on your screen that you can see. And let us know, what is your experience of using social and behavioral research in public health emergencies? We're beginning to get a bit of a feedback here. Excellent. So that's slido.com, #1594309. And we want to know what your experience is of using social and behavioral research in public health emergencies. There's 13 respondents, 14, 15. We'd like to see a few more, please. Yeah, okay. There are quite a few, about a third of the people have been used to find informing programs. Some have supported others. That's now the lead. Please do join everyone, slido.com, #1594309. Even if you haven't been involved in this area, just say that. That's fine as well. But we'd really like to know more about you. Okay. So we have 23% who've used findings, 24% to inform programs and response strategies. Although there are quite a few that have not used this type of research before, which would also be useful for you to know more about it. Okay, so now I will stop sharing the screen, but the Slido is open, so you can continue to respond to Slido throughout this webinar. But I'm just stopping sharing the screen. If you could go to slido.com, #1594309. Okay, thank you. And over to you, Nina.
Thanks very much, Supriya. It's great to get a sense of the folks who've joined this webinar and your experience so far with using research. And I just want to clarify up front that we use the term research here quite broadly. Really what we're thinking about is how to produce scientific evidence in a way that it can be used and useful for public health responses. And, you know, sometimes that data and evidence is actually embedded very much in public health response work. So sometimes there are things like rapid qualitative assessments that take place, or very rapid surveys. And those are thought of more sort of in the context of operational type research, or operational data and evidence that is really collected to strengthen programming. So something a little bit different to the kinds of studies or more formal research that you might see from academic institutions. But the guidance is really intended to speak to that whole spread of data gathering activities. And we're primarily interested in how can we bring data and evidence to the table to inform immediate public health responses. That's not to say that other forms of research that might influence preparedness or responses to future events is not important, but our primary focus is how can we make sure that our emergency responses are data-driven and critically bring data and information about the experiences and the lived experiences of people who are affected with mpox. So this is, really what we see in many, many public health emergency responses is that there's a lot of biomedical evidence that comes to decision-making tables. And what we need is more evidence on the lived experience and what communities are seeing and feeling and needing and the solutions that they are bringing to the table so that public health response is more integrated and more community-centered. There's actually a lot of activity, particularly for mpox, related to this kind of work. There's a lot of teams that are doing some of this work, but what we see is there's a real variability in practice. So part of the purpose of the guidance is to bring forward standards and norms for doing this kind of work. And a critical piece that we have included in the guidance as well is the use of evidence. There is value, but not as much value if that data and evidence doesn't reach decision makers so that they can't use it to account for the decisions that they're making in terms of the policies and the approaches that they are implementing in responding to mpox. And this is what we mean when we talk about putting communities at the center using evidence. We're talking about making sure that that evidence properly represents the many communities that are impacted and affected by mpox. So this is principles-based guidance. And what that means is that we've really grounded this guidance in what is known around best practice in this area. There's many ethics frameworks, there's many public health guidances that have been written at international level that have involved a lot of people putting a lot of thought into what do we mean by research in an emergency? Because there's a lot of quite specific challenges around trying to do research in very dynamic and time-pressured contexts. And what we need is high-quality data and evidence that is trustworthy. And so there's many other groups that have thought this through. And we started our guidance development process thinking about what is existing and what can we draw from. And the gap that we saw was that while many of these frameworks have thought about these big questions around public health emergency research and evidence, they haven't necessarily addressed the community component. And so that's the gap that we looked to fill. So as we've said, the guidance came together very quickly. It happened over about 4 months from November last year, but at the same time, WHO has very clear quality assurance processes. So we needed to follow a very transparent and rigorous process for developing the guidance. And so one of the ways that we did that was to work with many, many, many different stakeholders. And so we started with our evidence review. We did a survey to understand the needs of people responding to mpox outbreaks. What were their evidence needs? We also then had a big stakeholder meeting in Kinshasa last year in November. And we have a report of that event. And we will put the links to that report both in English and in French for you to review. And we then worked with a technical expert working group. And we also had multiple rounds of consultations, including a specific consultation with civil society stakeholders to get their feedback. So it's really been very much a team and collaborative process to produce this document. And it covers 5 core areas. It covers planning, design and delivery, thinking about what are the questions you want to ask, how do those questions help to improve public health response. It covers multi-stakeholder engagement. Who are the different groups that need to be engaged? The communities are central. We also need to engage many other stakeholders, operational partners, response decision makers, people working in ethics committees, and so on. It addresses questions around ethical practice. Not all of this work needs to go through formal ethics oversight. So not all of this work needs to go to an ethics committee, but then the work still needs to, even if it has or hasn't had an ethics review process, it still needs to be practiced ethically in the field. And they're very real harms that can surface if data are not collected with attention to things like confidentiality, data privacy, data protection, and so on. It also covers data protection and sharing. And finally, it looks at what is the broader system level pieces that need to come together to make sure that this evidence can be produced in time and reach the people who are making decisions around the public health response in ways that it's accessible, useful, and usable to them. To help with implementing the guidance, of putting it into practice, we have 2 operational support tools, and we will share those with you towards the end of this session. And we also have a community of practice that has come together, and that is on our WHO Hive platform. And I'll give you more information on how you can join that platform if you'd like to stay engaged in this conversation beyond the webinar. But at this point, I'd like to introduce our panelists, all of whom have been engaged and involved at different points in the guidance development process. And I'd like to hear from them and invite them to make their comments on the challenges that they see that this guidance can help address. So if I could ask our panelists to please turn on their video screens, and a very warm welcome to Cesar Abuza Mumbuza, who's the coordinator of a civil society organization, the Congolese Network of Religious Leaders living with or personally affected by HIV or AIDS. Cesar, bienvenue. Thank you for joining us. Our second panelist is Ferdinand Nsengimana, who's a researcher at the National Public Health Institute in Burundi, a country that, of course, has been affected by this recent public health emergency of international concern, this particular clade that's given rise to this emergency, and a country that's newly affected as a result of this emergency event. And I'd also like to invite Dr. Gillian McKay, who's a senior health research advisor, to bring us the funder's perspective. Gillian comes from the ELRA organization that was instrumental in supporting the funding for some of this work. If I could ask you to turn on your cameras and join us. Thank you for joining us. And Cesar, I will start with you. You know, we've spoken a lot now about the importance of communities being at the center, not only of research, but also of response. Why is this important from your perspective? Over to you.
Et merci beaucoup pour l'opportunité que vous me donnez encore, parce que nous étions ensemble pendant la télé. Comme vous venez de dire, c'est important. C'est important pourquoi? Parce que, vous savez, les membres de la communauté vivent au cœur des problématiques qu'elles rencontrent. Les membres de la communauté connaissent très bien à identifier les besoins spécifiques, les priorités et leurs défis. Et ils les identifient d'une manière précise. C'est pour cela que c'est important que la communauté puisse être impliqués, puissent être engagés parce qu'ils comprennent à profondeur les besoins locaux. Ça, c'est très important d'impliquer la communauté. Mais aussi, la communauté doit être impliquée. Pourquoi? Parce que la communauté, quand on les implique, ils développent des solutions qui sont susceptibles de répondre aux réalités réelles, aux réalités locales. Souvent, les chercheurs sont au-dessus de ce que la communauté est. Ils viennent avec leur compréhension des choses. Ils viennent avec la façon de voir les choses. Mais lorsque les chercheurs intègrent dans leur façon de voir les choses, que ce soit dans la communauté de pilotage, que ce soit dans toutes les étapes, ils intègrent la communauté et la communauté, tellement qu'ils connaissent leurs problèmes, les solutions qui seront données, ça sera une solution acceptée et une solution qui sera une solution locale adoptée. C'est très important que nous puissions intégrer la communauté. Mais pourquoi c'est important encore? C'est important parce que ça donne à la communauté le goût d'appartenance. C'est-à-dire que lorsque la communauté est impliquée, la communauté se sent propriétaire des résultats qui vont sortir. La communauté se sent motivée. Et les solutions qui seront proposées, la communauté sera capable, sera prête à répondre. C'est très important. Vous savez, aujourd'hui, l'mpox nous a montré qu'il y a un certain groupe membres de la communauté qui sont touchés d'une manière disprofessionnelle. Et c'est important que lorsque vous voulez travailler, par exemple avec la communauté des personnes vivant avec le VIH/SIDA, par exemple avec la communauté des professionnels de sexe, par exemple avec la communauté des hommes qui ont le rapport sexuel avec les hommes, s'ils ne sont pas impliqués, lorsque vous amenez une solution qui vient d'ailleurs, souvent la communauté font obstacle à cette solution-là. C'est pour cela que c'est important, parce que la communauté, si c'est impliqué, la communauté permet à la recherche d'avoir une adaptation locale. C'est vraiment important. Mais c'est important aussi pourquoi? C'est important aussi parce que ça renforce l'appartenance. C'est-à-dire que la communauté se sent propriété des résultats, mais aussi ça montre la durabilité dans les changements. Lorsque la communauté est impliquée, il s'approprie le processus, il s'approprie le résultat et ils mettent en œuvre les recommandations. Et ils sont prêts que ces recommandations-là, ces résultats-là puissent être perdurés dans la société. Voilà, ces éléments-là montrent que c'est très, très, très important d'engager la communauté. Et même les termes que vous avez employés dans les documents, c'est un terme très capital. Mais aussi, lorsque la communauté est impliquée, ça fait partie des renforcements des capacités locales. Vous savez, si vous êtes dans une recherche et que vous utilisez la communauté, par exemple, comme chercheurs juniors, comme des enquêteurs, comme des superviseurs, ça renforce les capacités de la communauté. Et ça donne à la communauté leur propre développement de travail. C'est important. Mais aussi, l'implication de la communauté permet d'améliorer les résultats, la collecte des données. Par exemple, dans mon pays, on a fait une enquête, c'était pour cartographie de la société civile, mais spécifiquement des populations clés. Et on était parti dans une région où le responsable des zones de santé nous a dit qu'ici, il n'y a pas des hommes qui ont le rapport sexuel avec les hommes. Pourquoi il avait dit ça? Parce qu'on avait utilisé les gens qui n'étaient pas de la communauté. Et comme ils n'étaient pas de la communauté, la communauté s'est mis comme obstacle. C'est-à-dire que vous ne pouvez pas voir d'une manière facile les hommes qui le rapport avec les hommes dans certaines communautés parce qu'il y a la stigmatisation. Mais lorsque vous intégrez la communauté et que la communauté est impliquée et que la communauté travaille pour collecter les informations auprès de leurs pairs, les informations que vous allez collecter, ça sera des informations fiables, ça sera des informations qui seront représentatives. Et c'est très, très important que nous puissions impliquer la communauté, que la communauté puisse être engagée à tous les niveaux, que ce soit pendant la conception des problématiques, que ce soit pendant le développement des questionnaires, que ce soit pendant la collecte des données, que ce soit pour représenter les résultats. C'est important que la communauté puisse s'impliquer. Je suis très flatté lorsque j'ai suivi Dr. Jérémy qui a dit que la communauté doit être en amont, la communauté doit être aussi à la fin. C'est important aussi pourquoi? C'est important parce que ça permet aussi de valider les résultats. Lorsque vous faites une recherche dans une communauté, par exemple auprès des professionnels des sexes, par exemple auprès des PVV, et que vous faites ça d'une manière isolée. Et lorsque vous amenez les résultats, des fois les résultats là ne sont pas acceptés par la communauté. Et des fois les résultats, pour eux, ils ne trouvent pas ça que c'est pertinent. Donc ça aussi, c'est important que nous puissions intégrer, puissions renforcer, puissions aider la communauté à être impliquée. Mais ce que je voulais aussi ajouter dans l'engagement communautaire, c'est les liens sociaux aussi. C'est très important. Lorsque vous voyez un médecin qui est chercheur, investigateur principal, qui s'assoit à côté d'une maman, qui est par exemple collecteur de données, et l'autre s'assoit à côté d'une personne vivant avec le sida, à côté d'une sage-femme, tous ensemble ils réfléchissent pour trouver une solution à un problème donné, ça crée cette cohésion-là, ça crée cette collaboration-là qui fait que les acteurs sont faut ensemble, fait que les acteurs sont presque, regardent la même direction. Donc, c'est important que nous puissions vraiment intégrer la communauté. Mais je voulais soulever aussi autre chose. Lorsque vous intégrez la communauté, il faut veiller sur la sensibilité. La sensibilité, ici, je parle parce qu'il y a des communautés qui sont stigmatisées. Avant l'impox, ils étaient déjà stigmatisés dans notre communauté, mais l'impox est venu encore et ces groupes de communautés sont encore plus touchés par l'impox. Et lorsque vous faites des recherches auprès de ces communautés-là qui sont stigmatisées, c'est important de veiller sur la sensibilité de la communauté. Et c'est important de travailler sur la lutte contre la stigmatisation, la discrimination. C'est important de mettre en amont le droit humain, quelle que soit les conditions ou bien la particularité de votre pays, mais c'est toujours important de mettre la santé de la personne avant, de mettre le droit de la personne avant. Et lorsque vous travaillez avec la communauté, et que surtout avec la communauté qui sont plus stigmatisées, plus discriminées, c'est important que vous puissiez essayer de voir les acteurs qui sont là. Est-ce qu'ils ont une information sur la stigmatisation? Est-ce que les données qui seront collectées seront gérées pour combien d'États? La confidentialité. Est-ce qu'on n'aura pas demain un pesanteur politique qui va demander de donner les informations de la personne que vous avez collecté les informations? Et ça, si vous ne jouez pas sur ça, vous allez encore ajouter une autre nuisance à la personne qui sont déjà été, été marginalisée. Donc, voilà un peu ce que je pouvais dire par rapport à l'engagement communautaire. L'engagement communautaire dans la recherche, c'est une approche qui permet que nous, la communauté, nous gagnons et que vous aussi, vous gagnez par rapport à ce que vous recherchez. Mais au finish, c'est nous, la communauté, qui va gagner parce que nous avons fait ensemble un travail qui peut nous amener dans un changement dans notre communauté. Voilà un peu de mots ce que je pouvais dire par rapport à pourquoi c'est important, pourquoi c'est capital, que la communauté puisse être impliquée. Et cette implication-là, ça ne doit pas être symbolique. Cette implication-là, ça ne doit pas être une implication au niveau des collègues, parce que souvent, on nous implique d'une manière symbolique. Tout se fait en amont et on vient seulement, par exemple, pour nous questionner. Nous ne sommes que des répondants. Alors que nous pouvons être aussi des acteurs. Et ça renforce les capacités des acteurs. Aujourd'hui, quelqu'un qui est communautaire, qui est collecteur de données, demain, il peut être superviseur. Et après, 4 études, il peut devenir un investigateur junior. Voilà l'importance d'impliquer la communauté dans la recherche. Et c'est un engagement qui est vraiment important. Voilà un peu ce que je voulais apporter par rapport à ce que vous venez de faire comme document, qui est très important pour nous. Et nous remercions toute l'équipe qui a travaillé là-dessus, depuis que vous étiez venus à Kinshasa pour la télé, et qu'aujourd'hui, nous avons ensemble un document. Et nous espérons, malgré quoi, le temps qui était parti pour faire une recherche rapide, pour trouver les solutions rapides, n'oubliez pas d'impliquer la communauté. Et si vous le faites, vous aurez les résultats les plus fiables et la communauté va avoir une solution qui est adaptée à sa communauté. Voilà ce que je voulais dire.
César, a grand merci. Very many thanks for your contributions, and it's always a pleasure to hear from you very clearly articulated the critical importance not only of engaging and involving communities, but also of supporting communities to do their own research and to be actually leading that process. So really, really important points. I can see in the chat there are also questions related to stigma and related to, you know, concerns and sensitivities around research itself, not actually inadvertently making the stigmatizing process work. And I think these are very important points that you raised to us very early in the development of this guidance, and something that we have actually addressed in the guidance to some extent. So thank you again for joining us and for making those comments. I'd like to come across now to Ferdinand. Ferdinand, you are involved in planning and delivering some of this research from a National Public Health Institute point of view, in terms of thinking about what is the data and evidence that's needed related to communities to make sure that, you know, responses are more community-centered and orientated. And you are living face to face with many challenges that this guidance has aimed to address. So over to you for your thoughts around the day-to-day challenges from your perspective that this guidance can help solve. Over to you.
Thank you very much, Dr. Nina. And good morning, good day, good afternoon, greetings to everyone. My name is Ferdinand Sengimana and I'm in Burundi. Yes, in research, there are a number of challenges, but some of the challenges that I can mention here that these guidelines can assist, can help with. Think of that good morning when you wake up and you wonder, where do I start with this research? What do I do in here? And perhaps some few hours, I don't know how many minutes one will spend trying to figure out how to start, and time will be moving. Now, with this guidance, it's kind of an aide-memoire or a blueprint of what needs to be done. You don't have to waste time thinking about how to start. The guidance tells you this is what ought to be done. And sometimes it even gives you guidance on how to tackle some of the issues in there. Another point, yeah, sometimes as a researcher, one would start down writing a proposal, and then you wonder, how am I progressing? Is really what I'm doing what I'm supposed to be doing? And I recall sometimes you are in the middle of a proposal and you just drop down and you have to restart all over because perhaps you didn't follow one way or the other. The guidance will help to know that since you've moved from step 1, you are now at step 2, and so you move from step 2 to step 3. No time again to waste. This is for the researcher, the one who's developing a proposal, the one who will go out and collect data, or the one who will analyze data and write a report. But we shouldn't forget that before even going to collect data, the proposal or the protocol will be reviewed by a number of people. Now, putting oneself in the shoe of the reviewer who receives a document, and then in the end of the day, 3 or 4 more different documents have been brought to their desk, and each document looks different. It's in a different format. The content aren't aligned the same way, so the reviewer might feel that pressure of trying to figure out what is what in each document. Now, with these guidelines, following the guidelines is like each document produced will look like the other. That makes it easier for the reviewer to follow and to know what to expect once they start treating one document. And again, hopefully removing that challenge of wondering where to start and where to go for the reviewer will reduce the amount of time it usually takes to review a document and give ethical consent and so on. So yeah, in the end, we all know that we have a limited amount of time every day, but anything that can save us time will be saving anything else that goes with time here. I can't mention money because I'm sure we all know that time is money, but there's also effort, energy that one spends trying to do work over and over. If we know or if we have a guidance on how to do things, that saves us a lot of energy in the end. So, as I said, these guidelines are kind of blueprint documents. They are kind of aide-memoire for the guidance, to guide us on what to do. and how to do it. I thank you very much. Dr. Nina, back to you.
Ferdinand, thank you so much. It's very, very helpful comments. And yes, I think we have tried with this work to be as practical as possible and to really think about, its usefulness to people. So it's really great to get your reflections on the final product. And of course, your involvement in the technical working group was pivotal to some of this work. Gillian, I'm going to come across to you to give us the funder's perspective. Why would, we would say, we know exactly why we think this work needs dedicated funding support and attention. But in your view, as a member of the funding community, what are your thoughts?
Right, thanks for the question, Nina. I mean, the reality is I'm slightly biased here because I myself, I have a background as a social scientist in the infectious disease space. So I'll always be an advocate for funding and support in this particular field. But that does make it really easy for me then to speak on behalf of ELRA's Research for Health and Humanitarian Crises program, because we really do believe that rigorous social and behavioral science is essential for good quality response to disease outbreak. I mean, my own experience as a researcher in West Africa and in North Kivu, Ebola outbreaks, it brought to life for me as a responder that I needed to understand how the virus spread, how people experience that spread, what shaped their choices, and how they engage with the response. And that's really why it's so important, I think, to do this kind of research in mpox and beyond, because it can teach us as responders what's working and what isn't. But the reality is doing good quality social and behavioral science, it takes time, it takes care, and it takes human and financial resource. And it's often underfunded and undervalued compared to biomedical research, even though, let's be fair, it can often be done faster and cheaper. And without doing really good quality social and behavioral research, we really risk designing responses that aren't contextually grounded, they're not acceptable to the people they aim to support. And so, it's not a good investment, and it's not going to stop the outbreak that we're looking to stop. So dedicated funding, as you say, is really essential to make it possible to support local researchers, uphold ethical standards, and ensure the work is done well and quickly, so it can be responsive in real time to the needs of the response. So when I was first looking at opportunities for ELRA specifically in the mpox space back in August 2024, I felt very lucky because I had a call with you. And I already knew that social and behavioral science was probably going to be the route that we were going to take as a funder, because we didn't have a big pot of money. We weren't going to be able to invest in vaccine development. That wasn't going to be our path. But coming from the background of social and behavioral science, I knew that it could be incredibly impactful if we could use it in the right way. So I'm so glad that you and I and a huge number of other collaborators came together to make that meeting in Kinshasa happen that really contributed to this guidance. And it was a real honor to work with you on that. And I was very grateful, of course, to our funder, the UK Foreign, Commonwealth and Development Office, for their support. I think for us, this guidance, it really links to our long-standing experience in COVID and Ebola and other areas of humanitarian health, and also really aligns with broader ambitions that we have to engage more deeply with global and regional policy actors, and to ensure that the evidence that we support influences real-world outcomes. And this guidance really contributes to that. It's only one part of our mpox program. We're funding other social and behavioral science projects because we want this guidance to be used, and this is one way for us to do that. Those projects, they're really designed to generate actionable evidence. They can focus on stopping the mpox outbreak, specifically in DRC. They're not academic exercises. They're for real-time response. They're answering real-time questions. They're working with communities. They're working with local researchers. And we're feeling really positive about how those are going to look. I'm aware of the time, so I'll just say, this guidance, it sends, I think, a really important message to responders, to funders, to policymakers, as well as to affected populations, that we value social and behavioral science, that we think that listening to affected people, understanding social dynamics, and elevating community voices is just as important as lab and vaccine development, and that we really want to center community experience in outbreak response. But that needs sustained investment. And so as a funder, I'm speaking to the other funders in the room, let's focus and invest in social and behavioral science.
Thank you so much, Gillian, and thank you for your support and your advocacy for this area of work. And also, obviously a big thank you to the other donors who've supported this work, to the Wellcome Trust, UK Foreign Commonwealth and Development Office, and also the Global Health EDCTP project that has ensured that all of their biomedical studies have a component that relates to community practice and social science. And in a way, if we think about the complexity of mpox outbreaks and many other public health emergencies, if we're only responding with biomedical evidence, we're only working with one part of the picture. We know, for example, that vaccines are only as good as vaccination occurs. We know that many, many health technologies can only really see their added benefit if they can be implemented, if they're accepted, if they're acceptable, if communities have access to them. And we cannot answer those questions without considering, the needs and the realities and the day-to-day experiences of people who are affected. I'm going to come to you with one final question, which I think also speaks to this question of impact, because all of this work needs to impact decision-making. And so what are your thoughts on that? What needs to be in place so that all of the work that we do around data, evidence, research, and so on actually influences decisions in ways that communities benefit? Because that's what we're talking about here, as much about, scientific value as really social benefit is what we want to see happening with this work. What are your thoughts?
That's to me, right? Just checking.
Yes. Yes, sorry, that's to you.
So, I think well, I can speak for Elra here, that I can say, we're incredibly proud that in the work that we funded in COVID and Ebola and in other health thematic areas, that we know that producing good quality evidence is only one piece. Like, you can't just do the research. You have to walk with the community to get that research really into action and into impact. And maybe I'll see if I can pop in the chat that we have a research impact framework that we're happy to share with those on this call. But in it, we talk about a number of different things, but maybe I'll focus on 4 key elements. So I think the first is, do research that is in response to the questions that responders and communities really have. You have to be answering the right questions in the right way in the right space, but you have to therefore do the formative work in the early stages so that you are getting to those right questions. It has to be demand driven. We feel that, equitable partnerships are essential, especially when you're bringing together local researchers and frontline humanitarian actors. Helps make sure that those the findings from your questions are grounded and owned by the people who really need to make use of the results. You need to engage key actors from the start. I think our colleague Cesar really spoke very strongly about this one. The ministries of health, humanitarian agencies, community organizations, they have to be there from the early days, because they're the ones who are going to action a lot of the work that comes out of the findings. So where possible, it's important to bring them on board and to use familiar platforms. They exist. There's coordination mechanisms. There's technical working groups. Let's not reinvent the wheel every single time. Let's use what's there. And fourth, I would encourage all of us in the social and behavioral science community to really evaluate and share what we know about how research influences policy and practice. Being transparent about what worked, what didn't work, it helps us all grow. It helps us all do better research and better kind of evidence to policy, kind of filling that gap. And one way that we do it personally is through our impact case studies, and those are available if anybody wants to have a look. We'll be doing that for our mpox studies. Yeah, I think that's probably what I would say to that. We don't need to be limited by how we've done things before. There's space, I think, in this new guidance, using this new guidance for new partnerships, new questions, new approaches. And it needs to be core to how we respond to mpox, but also I really want to emphasize that I think this is so valuable for beyond the mpox space, for other infectious disease responses, for other health emergencies, however they might occur. So again, thank you so much, Nina, for involving Elra in this work. We've been really honored to support it.
Fantastic. Thank you so much, Julian. And I think that point about how we move from the sort of mpox focus, which has been the focus of this work, to thinking about transferability to other emergencies is so key, especially if we think that many of these emergencies don't occur in isolation. Mpox outbreaks are happening alongside measles outbreaks, alongside cholera outbreaks, and so on. At this point, I'm gonna open the floor again to hear from yourselves, and Supriya, over to you for the second Slido question, and we'll see if we have any time to take some of the fantastic questions that have been coming from the floor. Thanks. Over to you, Supriya.
So we have one more question for all of you. So you've heard about the guidance. I can see all your comments, and that's really interesting. In what ways do you think you could apply this guidance to your work? There's only 2 responses so far. Please, slido.com again, hashtag 1594309. The second question in slido.com, hashtag 1594309, or just scan the QR code. We have 52 responses, and most of you are going to be informing community engagement strategies. Fantastic. A few more will be designing or adapting research protocols. I hope we'll get some more responses from you. Do join us at slido.com, hashtag 1594309. This will be open till tomorrow. We'd like to have your views, but now, in the interest of time, I will stop sharing now. But please do continue with your feedback. And back to Nina.
Thanks so much, Supriya. And yes, please, a warm encouragement from me and all of the team to please continue with your feedback, because we will gather that, we will look at that, we will look at all of the comments and reflections and questions that have come into the chat. And we are seeing many of the questions that have come in to the Q&A section as well. And we will, of course, not, with the time allotted to us at the moment, be able to address all of those. But I did just want to pick up on one. And Cesar, this is a question for you. The question was, how do we ensure that marginalized groups are not further stigmatized by research activity during an outbreak response?
Ok, merci beaucoup. Qu'est-ce qu'il faut faire pour que le groupe ne soit pas de plus stigmatisé? La première des choses, c'est que les acteurs qui vont faire les études, les recherches, soient formés par rapport aux droits humains. C'est très important. Même des briefings sur les droits humains, c'est très important. Ça, c'est la première chose. La deuxième chose, il faut avoir des sécurités. Des sécurités dans le sens de l'entretien. Est-ce que l'entretien que vous allez faire avec les groupes les plus marginalisés, vous allez le faire où? Le plus important, c'est d'intégrer les groupes, les communautés, les personnes marginalisées. Elles savent, elles vont vous dire, pour telle enquête, pour telle interrogation, voici, nous nous réunissons dans tel endroit calmement. Donc, c'est très important. Au lieu que vous puissiez aller, soit vous les amener dans un centre visible où les gens vont les voir ou vont les stigmatiser, il faut les demander. Ils savent. Par exemple, moi, je vous dirais, voilà, nous nous rencontrons dans tel endroit, 5 personnes. Et vous allez vers ces gens là-bas. Et aussi, si vous questionnez une personne, vous pouvez faire la chaîne à travers la personne que vous avez questionnée. Est-ce que c'est possible d'avoir votre père qui peut accepter de participer à l'enquête? Essayez de mettre les garde-fous pour que la personne ne soit pas plus stigmatisée, discriminée. Mais aussi les gens qui vont poser la question. Et ces gens-là, parce qu'il a des pesanteurs, surtout chez nous en Afrique, il a des pesanteurs sociaux, des pesanteurs religieux. Vous allez voir même quelqu'un qui vous pose la question, au lieu de se limiter à la question qu'il vous pose, il commence à vous donner des morales. Ou soit il commence à parler de Dieu. Ok, les gens qui vont faire la recherche, à part l'éthique, il y a certaines notions qui doivent intégrer des respects des droits humains. Ils doivent intégrer ça, que ça soit leur habitude. Voilà un peu deux, trois choses que les gens peuvent faire pour ne pas rendre encore plus vulnérable la communauté. Les intégrer afin qu'ils puissent choisir l'endroit où vous allez faire l'entretien et intégrer parmi les gens qui vont faire les collectes de données, les pairs. C'est très important parce qu'entre les pairs, il y a un degré de confidentialité plus élevé que si vous n'êtes pas les pairs. Voilà un peu trois mots que je peux ajouter par rapport à ça.
Cesar, thank you so much. And I think, just such sensible and sensitive and humane reflections in terms of what we can do as researchers to make sure that the work that we do is sensitive and does not do harm. I think it's absolutely critical. And so I think listening to your response, what you're saying is humility and listening will go a long way, right from the very beginning, from the questions that you ask to the way that you might conceive your research. And I think we also need to be mindful that in some instances, if our community stakeholders say to us, it's just not a good idea to do this research, then that's also a decision to be taken. So a very, very many thanks, Cesar. Thank you, Ferdinand. Thank you, Gillian, for joining this discussion. Really fantastic to speak with you as always, and very insightful responses. We look forward to continuing the conversation. And I would like to invite everybody who's on the call to consider joining our Hive community of practice. So this is an invitation-only digital platform, and the idea is to foster collaboration and knowledge sharing. So on this platform, we share resources, we share expertise. You can bring your questions. We will engage with further discussions around the guidance if that's useful. What happens is that you will sign up to this link. You can see here that there is a link, this QR code. You click on the link, you sign up, and you will then receive an invitation from the Hive. That is your unique link to join the knowledge translation community of practice. We also have a series of community of practice meetings. We've got another 3 planned for the rest of this year. Those are hosted in English and French. And again, many thanks to our donors, to ELRA and the UK Foreign Commonwealth and Development Office for their support for hosting this community of practice. And I think on that note, we are ready to thank you and to close this webinar. I have to say it's been incredibly heartening to see the responses, the engagements, the questions, the chats. So a big thank you from me. Nadret, any comments, final comments you'd like to make?
No, I'm happy, very happy to be listening and those very rich experience, accumulated knowledge. And I think we have to create similar platforms for other guides and tools. And as I always mention, and getting closer to with the civil society is a critical step. So we have to facilitate this with the communities.
Thank you so much, Nadret. Thank you so much for your support and for always advocating for this area of work. Much appreciated. And on that note, Supriya, are there any final EPI-WIN related closure points we need to attend to? Signposting.
Nina,
Yes,
I'd
thanks.
like to thank all the participants and all the audience coming from different parts of the world for attending today. I'd just like to share that, as always, we have another EPI-WIN webinar next week, which is also on mpox, but on a completely different perspective. So please do join if that interests you. I'd like to thank Nadret, Jeremy, all the panelists, Catherine Littler, Nina, Julian, Sarah, but also everyone in the background, Olivia Tulloch, and then the Project Echo team, Brian Yao, who's been managing some of the IT as well as our IT support. And I'm sorry, did I miss anybody out? I hope not. But thank you so much. And see you next week. And thanks for your time.
Merci beaucoup. Merci beaucoup. Merci beaucoup.
Merci.
Merci. Thanks, everybody.